I mean, obviously, you mentioned it's allergy season, but it's also wildfire season. We've seen some wildfires not far from us.
Yes.
What impact can that piece of it, the smoke, the dust, the ash, have on people?
It can have a very large impact. For people who have asthma, a lot of times it's the particulate matter that can set them off, and not just the allergies. And we see that a lot from like the smoke that we get from like the Saharan dust as well, and then our wildfires that we're having. That it can cause people to have twitchy airways and go into asthma attacks.
So is that something you kind of see a lot this time of year in your practice?
Yes, it sure is, and especially with the springtime allergens kicking up, this is a big time for people to have issues with their allergies and their asthma. And there's a thing that's called the Baylor Rules of Two. That if you're coughing, wheezing, or short of breath more than 2 days out of the week, or if you're waking up in the middle of the night more than two nights out of the month, that your asthma is out of control and you need to do something different with it. So for all those asthmatics that are out there, when during this season, don't use your albuterol every single day and think that that's supposed to be normal. That's where you go talk to your doctor and see if you could do something else.
Um, and so who's most susceptible to having issues related to smoke and things like that? Is it people that have asthma? Is it people that already have certain allergies?
Yeah, so it's the people who have asthma are at most risk of having breathing difficulties. For everybody, just the exposure to the smoke, it's going to cause the stuffy nose, the runny nose, the congestion where it's difficult to breathe. And so a lot of people will automatically go out and go to antihistamines. So antihistamines help with itchy, runny, sneezing. They do absolutely nothing for stuffy. That's where you have to use the decongestant, or like the Sudafed will help with the stuffiness, or the over-the-counter nasal steroids. But one of the biggest things is a homeopathic thing called saline irrigation. So like with neti pot, Neomed sinus rinse, Sinugate, or anything like that, to kind of rinse all the stuff out, because the smoke and the pollens get into the sinuses, tells the allergy cells to release all the chemicals that cause all the symptoms. Plus, it recruits more cells to come do the same thing. So, one of the biggest things you can do is, after you've been outside on high days, on high smoke days, is go home, shower, shampoo your hair, and rinse your sinuses out, rinse your eyes out with wetting solutions, and that can help significantly.
It sounds like kind of a silly question, but obviously it's a super windy day. How much of an impact can the wind have when it comes to these smoke particles, or to just other things? You mentioned we're getting into spring allergy season. How much of an impact can that have in really kind of kicking this stuff up, or other pollutants as well?
Yeah, and it can be huge, because with the strong wind currents that we're getting, pollen can travel up to 300 miles on wind currents. So it's not just what's in your yard; it's what's indigenous to your area. And as these winds kick up, it carries a lot of stuff in that you may not be exposed to on a regular basis. So it can kick your allergies up for sure.
And obviously that can apply to these smoke particles from hundreds hundreds if not
Yeah,
more
yeah,
miles.
absolutely. Yeah, and then of course the winds kick up the wildfires that are already going on, make it tougher, and make the air quality go down. And so, you're looking at the air quality index, and just kind of follow that along and see what's going on. And you can find that easily on the web, where it talks about this is in the healthy range, this is in the unhealthy range for certain people, and that unhealthy range for certain people are people with asthma or COPD, any breathing issues. And then you get up above 150 particles per million, and you get into the unhealthy for everybody, where it just starts causing breathing issues.
Yeah, and how much of an impact? I mean, obviously, it's uncomfortable. It's tough to breathe. You're getting these symptoms. How much of an impact can it have on just people's health from breathing this stuff in?
It can be significant, to where you're having difficulty breathing. You get the particulates into your lungs. If you're not clearing them out and coughing up the stuff, it can lead to infections. For your allergies, it can lead to bronchial hyperresponsiveness or asthma attacks, nasal congestion, that type of stuff.
And
So
so,
it's,
what
one of the important things that you can do is, if it's a high pollen day or high smoke day and you have to be outside, you can wear a mask. And then, when you're done, the showering and the saline irrigation helps significantly.
and so you hit on some of the treatments. What other things should people? What do you recommend people do if they're especially if they're more susceptible?
Yeah, so some of the big things is follow the pollen count. Don't go exercise early in the morning when the pollen count is super high. Go more in midday. Maybe wear a mask when you're outside. Wash your hands frequently. Don't rub your nose. Don't rub your eyes. And keep your windows and doors closed. Even though it's beautiful weather, when you're letting all the pollen into your house, you don't have any reprieve from it. So using your AC and just keeping the pollen on the outside are all things that can make a difference. For some of the people who are super susceptible to the airborne pollen, the HEPA filters in the house can also kind of give you a safe space. And then just the medicines on an as needed basis to help take care of the symptoms that you have.
And what can we kind of expect in the months ahead? I mean, we're really getting into that spring allergy season, right?
Yeah, and oak will be popping. So today, for the Austin area, we are at 9.6 on pollen.com, and that is the medium high range, and it's oak, ash, and poplar. So, and the oak season will be coming, and this one will probably have a vengeance with it.
You mentioned, I think, albuterol. As far as you were saying you shouldn't be using those kind of acute treatments too often. Can you talk a little bit more about, where that kind of threshold is, and what should people do if they find themselves reaching for that stuff a lot?
Okay, and yes, and thanks for bringing that back up again because I want to make it perfectly clear. Use albuterol as often as you need to. But if you're using it more than twice a week on a regular basis, you can have a condition that's called tachyphylaxis, to where you decrease the amount of receptors that are in your lungs that tell your lungs to open up when you're having an asthma attack, and the ones that are there don't work as well as they're supposed to. So if long term you're using your short acting beta agonist or your albuterol more than twice a week, you're at risk of having that. But please use it if you need it. Just talk to your provider if you're having to use it on a regular basis.
Perfect. Is there anything else you'd like to add that you think is important to hit on that we didn't mention, or anything else kind of about about the smoke, about the wind, or anything people might be dealing with?
Yeah. So one of the things that for if you're susceptible to smoke or if you're susceptible to allergies, it's easier to treat your symptoms before they start than it is to get it back under control. So if you're looking at the news and you're seeing that we have the wildfires and the winds are kicking the smoke up, start using whatever it is that you use to keep yourself in a state of wellness. And for your allergies, start that stuff a couple of weeks before your season starts, and it's easier to maintain control.
What about people who haven't necessarily treated this stuff before, but they're saying, hey, I think this is really bothering me. Where do you start with that?
Well, so it depends on what the symptoms are. If it's the itchy, runny, sneezy, that's where you can use antihistamines. The stuffy, you have to use the nasal steroids or the decongestants. There's also for a lot of people in Austin, they don't like the idea of medicines. The biggest thing is saline irrigation, and you can use some of the essential oils, some of the herbs over the counter like dried nettle or quercetin have some data to it that says that there might be some benefit. Also, local honey is another one that could have some potential benefit for it. So just whatever works for the patient, but start your treatment early.